Anxiety sucks. When you're anxious, your body and your mind tell you that you're in danger, even when you're not. Today, I want to give you some very practical tools on what you can do to feel better, because anxiety is very treatable. This is part 2 in a series, so if you haven't seen Anxiety Part 1 yet, it would be helpful to start there. That's where I explain how anxiety serves a purpose in keeping us alive. But our brains can overdo a good thing to the point of making us sick and miserable. I also explain the 2 separate regions of the brain involved in the process, the amygdala and the prefrontal cortex, and how our nervous system impacts our entire body. I'm psychotherapist Shavaun Scott, and on this channel, I respond to your questions on everything related to psychology, relationships, and mental health. If you enjoy this program, please like it and feel free to subscribe to my channel. Anxiety often goes hand in hand with depression, and it's the driving force behind PTSD and OCD. There are many additional things we do to specifically treat depression, PTSD, and OCD, but today I'm focusing primarily on the anxiety piece. I'll make subsequent videos to hone in specifically on the others. Let's start by imagining a simple anxiety thermometer, with the numbers on it beginning at 0 on the bottom and going up to 10 on the top. 0 represents a state of calm. Your body is relaxed, but you have energy. Your mind feels peaceful. You're able to focus and think clearly. This is what we refer to as a regulated nervous system. Now let's bump that number on that thermometer up to 10 and imagine the worst anxiety you've ever experienced. Maybe you're panicked, hyperventilating, your muscles are clenched, and you're ready for a fight, or you're frozen under the covers and curled up in a ball. Your heart is racing. You may be nauseous or sweaty. You can't think clearly. This is a state of severe dysregulation. Of course, it's best to be closer to 0. Now reflect for a moment and assess where you're at on that 1 to 10 scale today. If you're around a 2 or a 3, that's normal. Our numbers go up and down during a typical day, depending on the stress in our environment and what we're thinking about. But if you're at a 5, 6, or 7, you're uncomfortable. You're likely having some physical symptoms, and your thinking and focus are being affected. When your number moves higher, you may be irritable or feeling tearful, and it may seem that your emotions are out of control. You might behave erratically and impulsively or shut down and feel frozen. This is a state of emotional dysregulation, and if people get to a 10 on the scale, they're often in an emergency room with a panic attack. None of us want to go there. Some people chronically live in the fight, flight, freeze response and never know what it's like to get down to 0. Kids who grow up in chaotic or abusive families often have a very high level baseline of anxiety, and they carry that into adulthood. Their bodies always feel like they're in danger. There are 3 essential skills, I call them the S skills, that we can learn that help us rewire our anxiety circuits. The first of these skills is self-observation. Self-observation is the process of viewing ourselves from an objective place and noticing what our thoughts, feelings, and bodies are experiencing. We can identify and name our own anxious emotions, the thoughts that intensify those feelings, and the sensations in our bodies that follow along. The rapid heart rate, clenched fists or jaw, the tension headache. From this observer position, we notice what's happening without judgment. Now, it's easier said than done, but it's often how therapists help clients because we can observe things from the outside that they're not conscious of. And when we share our observations with them, it helps them connect the dots. The second S skill is self-monitoring. This is when we make a conscious practice to track how we're doing on a regular basis throughout the day. It means making a frequent practice of checking in with ourselves and assessing how we're feeling. That's the purpose of the anxiety thermometer exercise. We may start the workday out at a 1 or a 2, but then there's a problem and we catapult up to an 8. Self-monitoring lets us know that we need to get that number back down by moving to the next step, which is self-correction. Self-correction is when we take a constructive action to lower that number. We've observed, we've monitored. Now we're going to do something to help our nervous system downregulate. This is where healthy coping strategies come in. One action we can take to help develop these 3S skills is journaling every day, even if it's just for a few minutes. Focusing on putting our feelings and thoughts into words, along with describing the sensations we're having in our bodies, really helps build awareness of our patterns. Sometimes people tell me, but that feels like work. Well, yeah, it is, but it's worth a few minutes of time because it pays off. It's something we have to learn to do because these skills don't come naturally. Now, there are two directions to intervening in the anxiety state, and we refer to them as either top-down or bottom-up approaches. Top-down means we're working with our prefrontal cortex, our thinking brain, to interrupt or stop thoughts that are making us anxious. The classic top-down interventions are from cognitive behavioral therapy, called CBT. The bottom-up approach is working with our amygdala, which activates our automatic fight-flight response and causes us to react to stored emotional memories and sensations from our body. I think it's most helpful to integrate both approaches because people don't all respond the same to each technique. The first top-down intervention from CBT is to learn about anxiety so we can name it when it happens. The sooner we catch it, the easier it is to de-escalate. Recognizing anxiety as it happens reduces the sense that we're out of control. And once we recognize it, we can move into an action plan. If we notice our number going up, we can have the response, oh, here's my anxiety again. I know what this is. This is temporary, and I know how to work with it. This is the time that ideally we step back from a stressful situation and give ourselves a break to get regulated again. In a bit, I'll give a number of interventions from the bottom-up direction that can be inserted at this point. But first, let's look at another aspect of a CBT approach. This is to become aware of any negative or catastrophic thinking that we're doing that creates and feeds anxiety. For example, if we have perfectionistic tendencies and we make a mistake at work, we might immediately start criticizing ourselves and then feel ashamed. Our number shoots up as we imagine ourselves broke, homeless, and living on the street when we get fired. That's catastrophizing, and we want to stop those thought patterns. Anxiety-producing thoughts often happen automatically because they developed as core beliefs from childhood. All children integrate the things they hear from their parents into their own thinking as they grow up. And critical messages that pop up as adults are often things stored in our memory that we heard repeatedly when we were kids. Always assuming the worst, that something awful is about to happen, is also common in people who have a trauma history or whose parents constantly worried aloud about imagined coming catastrophes. This is why parents really need to keep from dumping their worried blather on their children. Dysregulated parents produce kids who tend to be dysregulated. We can look at cognitive interventions in a series of 3 steps. The first is to identify the self-critical or catastrophic thought. The second step is to look for the source of that thought. And finally, the third step is to challenge it with a more realistic thought. Once you've identified what these repetitive thoughts are, it's helpful to write each one out and then write a challenging alternate thought that's based in reality. Sometimes people need help to do this. For example, let's imagine a young woman whose parents were perfectionistic and they demanded perfect grades when she was a child. She was punished and shamed if she got less than straight A's. She's now in college. She no longer lives with her parents, but she begins to have panic attacks when she learns that she's not going to pass organic chemistry. Her automatic thought is that she's a failure, a loser, and she floods with anxiety and shame. She's stuck in the fight, flight, freeze mode, feeling frantic. Her core belief is that she's not worthy or loved unless she's perfect. The automatic thought tells her that she'll never succeed at anything in life, which objectively is absurd. Not only is none of this true, but her body is reacting as if she's fighting that saber-toothed tiger. By identifying the false automatic thoughts and toxic core beliefs, she can challenge them with the reality that no one is ever perfect, one class can be repeated, and that failing a class in no way predicts her success in the future. The first important step is being able to recognize, aha, here is my faulty belief again. I need to argue with that thought. It's not true. When we identify a negative core belief, we should ask ourselves, whose voice is that? Which allows us to recognize that the message originally came from someone else and it isn't based in the present reality. The things we heard as children become integrated into our brain as our inner monologue, and this is often a major source of anxiety. The harsher the parenting, the more intense the anxiety in the children, and that carries into adulthood. In many cases, it even justifies a diagnosis of chronic PTSD. Let me give you another metaphor I like to use. These faulty thoughts are like birds that are circling around and want to land on our head. They want to build a nest there. We feel the bird when it lands. We realize what it is. And then we can make a choice to either shoo it off or let it stay there and build a nest. Of course, you don't want a bird nesting on your head, so you shoo it off. And with practice, it gets easier and easier to catch it, even before it lands. Another example of a CBT intervention is to schedule worry time. Often, when people are anxious, they find themselves ruminating, going over and over something they're worried about in a way that's entirely non-productive. It's not solving a problem. It's not helping them in any way. It's keeping them flooded with the stress hormones, adrenaline and cortisol. And the thoughts are like a broken record. This is often fueling insomnia. One technique that helps with this is scheduling worry time. Scheduling worry time means that you pick a particular time or day when you'll devote a short time, like 10 to 30 minutes, exclusively to focus on the issue you're worried about. You sit with the thoughts and feelings and you problem solve. Now follow through on the planned worry time. Don't skip it. But when those worries pop up at any other time, you can visualize that you're putting them in a box in the closet and saving it for worry time. If you practice this enough, it gets easier to manage. You can tell yourself, now is not the time for me to be thinking about this topic. I'll do it when it's time. Now, to work with a bottom-up approach, we focus on sensations in the body and emotional processing. Using the following techniques will make it easier to identify and interrupt those negative thoughts and ruminations using different parts of our brain. A foundational way to help interrupt anxiety circuitry is to begin by working with our breath, which becomes rapid and shallow when we're in the fight, flight, freeze response. Square breathing is a technique that's easy to remember. This is how it works. You begin by slowly exhaling, then inhale through your nose to a slow count of 4. 1, 2, 3, 4. You hold at the top of the breath for another count of 4. Then you gently exhale through your mouth for a count of 4. At the bottom of the breath, you pause and hold for another count of 4. You repeat for a few minutes while you focus on letting go of any tension in your body from the top of your head down to the bottom of your feet. Relax your jaw, your neck, your shoulders. Let your arms and legs get heavy. And your heart rate will slow down as your breath changes and you start to feel some relief. Color breathing is another easy exercise. You close your eyes and imagine that your anxiety is a color. Any color is fine. Now you visualize where that color is held inside your body. Next, you imagine a different color that represents peace and safety. Again, it doesn't matter what color. There's no failure. Then, as you maintain a state of relaxation, you slowly expand your lungs all the way down to your belly and visualize breathing in the peaceful, safe color. And as you exhale, you breathe out the color for anxiety, letting it leave your body and sense it drifting away. We do this for several minutes, and it's super helpful for getting that number on the thermometer to drop. It also helps when you're trying to go to sleep at night. There are multiple apps that work similarly now, like Headspace, Calm, or many others. Many of them are free. So this kind of bottom-up approach can be done anywhere. Mindfulness meditation is extremely helpful to many people, but sometimes anxious people, particularly those with OCD or PTSD, find it very difficult to sit in silence on their own because they can be flooded with trauma memories or intrusive OCD thoughts. A lot of people tell me, I just can't meditate, I've tried, and then they feel like they've failed. I explain to those folks that there are multiple ways to meditate, and the guided meditation recordings where you listen to music or listen to someone speaking are very effective and are a great place to begin. Let me give you another technique that's evolved from the EMDR modality of therapy. EMDR is a comprehensive process that utilizes various kinds of bilateral stimulation. It was originally developed to help people process trauma that's stored in the memory system and the body, but it's used for many more things now. There's a very specific protocol for EMDR in therapy, and I recommend going through that with the clinician. But this next technique is adapted from EMDR, and it's easily done at home or work or wherever. This is called the butterfly hug, which helps with grounding and bringing down emotional intensity. You cross your hands over your chest like this, adjust to find what's most comfortable for you. And then deep breath in, exhale, and you slowly start tapping, alternating sides. You can add a positive affirmation, something like, I am secure, I am safe, I can do this, whatever seems to fit for where you're at. And you keep tapping as long as it's comfortable until you feel better. I've given you just a sample here of ways that therapists work to help people with anxiety. There's so much more. And again, no video is a substitute for therapy. Therapists who work with anxiety often use techniques from CBT, EMDR, DBT, all the letters, and other body-focused techniques. But as decades of research has shown, it's not so much the technique being used that determines the outcome of the therapy, it's the quality of the emotional connection or the resonance that develops between the client and the clinician. It's terrific when therapists blend techniques to meet their clients' needs because we do not all respond to the same things. Let me finish with the list that all my anxious clients get. Number one, find someone supportive to talk to about your struggles, but be careful it's not another anxious friend who just reinforces your catastrophic thinking. Co-ruminators are not helpful. If you're on social media, hang out with the kind people. Number two, minimize alcohol and caffeine. They only make anxiety worse. Alcohol may seem to help at the time you drink it, but several hours later, there's a rebound effect and the anxiety will come back worse. Then you just feel like you need another drink, and we know where that takes you. Number three, remember to put the worries in a box and schedule a time to think about them. Number four, minimize exposure to agitating news. It's fine to be informed, but let go of what you can't control and dose your exposure to it. Number five, get some kind of exercise or movement, preferably something that's fun for you as well as soothing. Yoga and Tai Chi are a tremendous help to many people, and you can follow along with videos online if you can't make it to class. Also, get out in nature whenever you can. It's so soothing. Finally, if you're consistently living at levels 7, 8, 9, or 10 on that thermometer, and you don't find that any of the techniques you're trying are helping, consider talking with a psychiatrist or mental health nurse practitioner about medication for anxiety. There are physiological reasons that some brains get stuck in an anxiety mode. And now that non-addictive medication options are available, there should be no stigma about using one of them. Now, I'm not talking about benzodiazepines here like Xanax or clonazepam, which are addictive and they will make anxiety worse long-term. There are other options a doctor can discuss with you, and I've often met people who told me that they regret not starting medication earlier in life because medication plus all the other techniques often bring the best outcomes. There's another specific treatment technique for anxiety, particularly for phobias, called exposure therapy, and I'll be covering that one in detail in a separate program. But I hope some of the information I've shared here has been useful to you. Please feel free to add comments about other things that you've found to be helpful for anxiety. We're all in this together and learning from each other.